There are dozens of Medicare plans out there, but let's be honest, most of them either cost too much or don't offer the protection you really need. So today I'm breaking it down, revealing the two best Medicare plans we recommend over and over again to our clients across the country. Be sure to stick around to the end because I'm going to also walk you through a real-world example of how one of these plans saved a client over $2,000 a year and how to avoid the biggest mistake people make when choosing their plan. Hey guys, Alex Wonder here. If you need help finding the best Medicare plan for your needs, don't hesitate to give us a call at the number below or use the link in the description to book an appointment with us. We'd be glad to help you compare options free of charge. After helping thousands of folks over the last 10 years, we've noticed that two plans consistently stand out, and that's Medicare Supplement Plan G and Medicare Advantage PPO plans. These aren't just the most popular, they're also the most reliable in terms of value, flexibility, and long-term protection. But each serve a different type of person. So let's break each one down. Medicare Supplement Plan G, often referred to as the gold standard in Medigap coverage, because you can see any doctor anywhere in the country that takes Medicare, no referrals needed. It covers everything after the Part B deductible, which is $257 in 2025. Low out-of-pocket costs, no surprises. So Plan G is perfect for folks with health conditions or those who want full freedom to travel or to go between states, such as snowbirds, or they want to avoid networks or pre-approvals, also known as prior authorizations. So anyone who wants to pay a little bit more monthly for peace of mind. We recently had a client in California that travels between 3 different states each year and was getting hit with out-of-network charges on their Medicare Advantage plan. We were able to underwrite them into a Medicare Supplement Plan G, and now they're able to go freely between the 3 different states that they travel in and see any doctor that they want that takes original Medicare. Yes, they're going to pay more monthly, but they're going to have that freedom and the peace of mind to avoid any of those out-of-network charges that they had on their previous Advantage plan. Now, one of the biggest mistakes we see people make is to stay on the same Plan G for years and never switch carriers. So over time, the premiums go up and up and up. And if you don't switch carriers, you're going to just keep paying more and more and more for the same Plan G. Last month, we were able to switch someone from a Plan G at $260 a month to a same Plan G with a different carrier for $180 a month, same benefits, and $960 a year in savings. So that's why the way the plans work for Plan G and the other Medigap plans is they're standardized, and any carrier offering a Plan G is only able to offer the same Plan G with the same benefits, but they are able to charge a different price. So that's why you can see a very big difference in price between carriers offering the same Plan G. And it's important to shop your Plan G if you have one to make sure you're paying the best rate. We can help you do that. Give us a call at the number below. Be glad to see if there's lower rates available for the same plan that you have, or potentially if you want to look at a different plan. Now let's talk about the other plan that we recommend often, and that's Medicare Advantage PPO. Now these plans are great for people who want low to zero monthly premiums, built-in drug coverage, dental, vision, hearing benefits, gym memberships or fitness perks, and local network flexibility with some out-of-network options. It's great for healthy individuals that don't go to the doctor that often, or folks that can't afford a Medicare Supplement Plan G or a different Medicare Supplement plan. Now, it's important to know that not all Medicare Advantage plans are equal. PPO plans offer a lot more flexibility than HMOs. Yes, PPOs do have more out-of-pocket costs than HMOs, but there's more flexibility. And with a PPO, you're typically able to go outside of the PPO's network and be covered. With an HMO, you're not able to do that, or at least with most HMOs, you're not able to do that. So when can you change plans? So you can go from Medigap to Medigap anytime throughout the year. And there's usually going to be underwriting required unless you live in a state that has special rules. For Advantage plans, typically the best time to change is October 15th to December 7th to go from Advantage to Advantage, or Supplement to Advantage, or Original Medicare to Advantage. But if you want to go from Medicare Advantage back to Original Medicare, or if you want to make a one-time change to your Advantage plan, you're able to do that during the open enrollment period that goes January 1st to March 31st. So Medicare Advantage plans, 2 enrollment periods, October 15th, December 7th, and then open enrollment January 1st to March 31st. Now, some common mistakes to avoid when it comes to the Advantage plans, that's going to be choosing a plan because your friend or neighbor did. Don't do that because your friend or neighbor is probably going to take different medications and have different doctors. So his needs are going to be different than yours. Also, not checking prescription coverage. A lot of folks call us and they say the plan they sign up for on their own doesn't cover their medications. So you need to make sure that you check to make sure your medications are covered by the Advantage plan that you're looking at. Now, to recap, the 2 plans we recommend the most are Medicare Supplement Plan G and Medicare Advantage PPO plans because they offer the most value and most freedom between the 2 Medicare plan types. Now, it's important to note that these 2 plan types are for different people with different needs. It's not a one-size-fit-all approach. If you have questions on what coverage or what plan is best for you, give us a call at the number below and we'd be glad to help you out. Also, don't forget to click like and subscribe to stay updated on all things Medicare. Thanks for watching the video and we'll see you on the next one. Thank you.